Hello everyone, this is Bob Browner with Community Coronavirus Update number 90. We'll talk about the latest numbers, a lot of the FAQs I get on boosters, vaccines, and travel, and a little bit of a history of the vaccine requirements. So good news, at least locally, Lancaster County, we put our mask ordinance in about 3 weeks ago back here, and it looks like things have peaked out about when you'd expect. Typically, it takes about 2 weeks to have the effect of a public mental health intervention shows up, and it looks like we've got a nice steady decline here, and hopefully we'll get down to low risk, safer territory in the coming weeks. Here at Lincoln Public Schools data is kind of confirming the same stuff. So we peaked out with our student staff exclusions 2 weeks ago and positives 2 weeks ago. This week here is still a partial week though, however, but still looks like a downward trend, so cautiously optimistic. We are experiencing statewide a shortage of testing supplies, so sometimes that can be an artifact, but I think in Lincoln this is a true number. If you look at Lincoln Public Schools data versus enrollment, it sounds like that's a lot of quarantines and exclusions. However, keep in mind that's only 2% of our student population that's currently quarantining, and only less than 0.16% that's actually currently positive as far as we know. That's actually pretty good. We've actually yet to have to quarantine yet to have to close down a single classroom. And so again, arguing for the effectiveness of our mask ordinance and our masking policies. Also, hospitalizations seem to also be confirming this. So hospitalizations of county residents have leveled off and may be starting to drop, whereas hospitalizations of people outside of our county are going up. So we're freeing up bed space to take care of those around us, which I think is a good thing. And so hopefully this trend will continue because it looks like there's people going to need a lot of help. I'm hearing a lot of my fellow colleagues around the state really struggling with being able to find a place for their sick people to send them to. So hopefully can we free up some space for them, those folks here in Lincoln. Kind of confirming again, Bryan Health does a great job of sharing its data publicly. They did have two pediatric hospitalizations over the weekend, both of them from outside of Lincoln, of course. So again, confirming that maybe our masking policies are working. One was discharged yesterday. I don't know why. Hopefully, they were healthy when they were discharged. You'll notice, though, that all the people who are not vaccinated that are in the hospital are older than this population. So people who are probably have more higher risk health conditions and maybe immunocompromised other reasons. Again, the visuals they show point out that none of the vaccinated people are on ventilators, though. So again, differences in severity there. And all the people on ventilators are in age groups that might surprise people. Two of them are between the ages of 18 and 29. Five of them are in the between ages of age in 30 and 39. So otherwise, people who shouldn't be this sick because they're not vaccinated. Also, I didn't have time to recreate this slide myself, so I stole it from James Lawler from his presentation Monday to the Nebraska Association of School Boards. We actually now have randomized trials proving that masks work. So this style in Bangladesh, they did it at the village level. And some critics would say, oh, but there's only about a 10% drop in cases based on masking. But I would point out they only got to 42% of the people wearing masks. So if they'd gotten to 80 or 90% of the people wearing masks, probably would have been a massive drop in spread. And of course, in our schools, it's 99% plus. That's why it's working. So we actually even have randomized trials now proving that masks work. And it's important for schools because to do this because schools are a key route of spread within a community. And I've used this article multiple times in the past, but literally a third of the community is directly tied to the schools. Either they work there, they're married to somebody who work there, they have a student that goes there, they're a parent of a student that is there, and they come home and go back every day. So if you want to control spread in a community, a school is where you need to do it. And again, it's not just the kids you're protecting, you're also protecting the parents. So, for example, yes, maybe the kids aren't dying at a high rate, but their parents are. And so, yes, the kid may be bothered by wearing this mask, but nowhere near as bothered as losing their parent. And we have had over 100,000 children in the United States lose a parent due to coronavirus. And that's much more of a threat to that child's health than wearing a mask, if there is any threat at all, basically. The other thing I frequently get is people I think are asking the wrong questions when they're asking questions about vaccines. So sometimes is it the wrong question? Maybe the answer is not working because the wrong question is being asked. And so people will often say, well, can the COVID vaccine cause X? Well, sometimes the answer is yes. So in terms of a stroke, myocarditis, Bell's palsy, yes, the COVID vaccine can cause that. But there are also things that it can't cause. So it does not cause infertility, and this unknown long-term side effects doesn't hold water any longer. Most side effects, all vaccine side effects that are known to exist for all vaccines happen within the first 1 to 2 months. So once you get sufficient data, it's pretty well characterized, and we have data on hundreds of millions of vaccine doses. So this unknown long-term side effects no longer holds water. However, this can the vaccine cause X is not the right question. A better question is how likely is the vaccine to cause X, because you need to make a risk decision here. So for stroke, it's about 1 in 100,000 to 1 in a million. For myocarditis, it's about 1 in 10,000 to 1 in 100,000. So that's a little bit better question because it gives you some ability to compare, but even that's not the best question. The best question is how likely does COVID cause X compared to the vaccine? Because your really decision point is should I get the vaccine? So you need to know the risk for each of them in comparison to each other. So for example, the Johnson & Johnson central venous thrombosis that caused the halt, yes, the vaccine can cause this, but the COVID itself causes it at a much higher rate. And this article, if you can go to link to, published here recently, showed it was 60 to 320 times more likely from the infection itself than from the vaccine. And we're getting this for quite a few other things too. So right now we have a comparative data now that's going to come out for myocarditis. And so COVID itself also causes myocarditis. It causes it across all age groups. You'll see here children less than 16, still a pretty significant rate for them too. And that's that worry that people have about myocarditis for kids because of the Pfizer. But again, it's higher. So what you're seeing now, which is very helpful, I think, are visuals like this. So the British Medical Journal looking, and they studied both the Pfizer and AstraZeneca. And AstraZeneca is important because it's very similar to the Johnson & Johnson vaccine that we have here in the United States. For every single condition, the rates were higher for coronavirus than the vaccine. And so again, it becomes a no-brainer decision. You should get the vaccine. And all the other things as well. So Bell's palsy, yes, there is a slight risk of increase in Bell's palsy from getting the vaccine, but the risk is even higher for coronavirus. For every single condition here, everything from heart attacks to strokes to seizures to pulmonary embolisms, the only one that wasn't was a swollen lymph nodes, basically. Well, if you get a shot in your arm, it's not too surprising to get some swollen lymph nodes nearby. That's your immune system doing what it's supposed to do. But for everything else, coronavirus itself is worse than the vaccine, so you should get the vaccine. The other question I get a lot is boosters. Well, this is kind of the raging topic. I think you're going to have an answer here within the next few weeks. What's producing this? Well, you are seeing some drops in the hospitalization protection from vaccines. So this came out just a week ago from the Centers for Disease Control, looking at the comparative effectiveness of the vaccines against hospitalization. Moderna was still holding at 95%, Pfizer's down to 80%, and Johnson only 60%. Why? Two possible explanations. The Moderna vaccine is actually a higher dose than the Pfizer vaccine. Also, the different time that the Moderna dose was 4 weeks later instead of 3 weeks, so it might have been better to wait a little longer with that second dose potentially. And so basically they are seeing some evidence of waning of immunity. The Israelis went ahead and started doing boosters back in July. They started doing boosters for everybody over 60. And because they have one unified health data system for their entire country, they were able to follow literally the entire country that was getting this, and their sample size is over, I believe, over 1 million, if I remember correctly. Basically, what they did is said, okay, when you get the vaccine, now wait 12 days later, compare those people. Did they get a reduction in hospitalization? And graphically, here's how they're showing it, that yes, they did seem to see a very big reduction in hospitalization 12 days after getting the booster shot. And this kind of confirms our own data. If you look at, who's at Bryan Hospital, who's vaccinated in the hospital, it's all people over 50. So maybe people over 50 we should start vaccinating. And of course, if you're following the news from the United Kingdom, they just announced they're going to do boosters for everybody over 50. And so I think the tide's pretty much turning here. So just in the next few weeks, I think you'll get some answers. Do we have absolute certainty? Yes, no. So back to last week's 40-70 Powell rule. I think we're here. This is good enough data for me, and I actually did go get my booster Friday last week. It was tolerated pretty well. I had a slight headache in the morning. I woke up, took some ibuprofen, but I still mowed the lawn and dug up some potatoes and stuff. So other than that, it was fine. So the third shot, I didn't bother me near as much. The second one actually. So I think that's what you're going to see. So I wouldn't fault anybody by going ahead. However, you can also wait a few more weeks and see what the final data is. But my prediction is we'll be launching booster shots in the next few weeks. And this wouldn't surprise me, if you look at the pediatric vaccination schedule, many of our vaccines are 3-dose series and even a booster the next year. So my prediction is we're going to have that third booster shot for us, either two doses if you're Johnson & Johnson, 3 doses if you're Pfizer, Moderna. And I wouldn't be surprised if a year from now we get another booster that's the new variants booster, kind of like how influenza, we get a new shot every year because influenza mutates so much. You have to get a new shot every year. So that combination of waning immunity plus mutation, it would not if I had to bet money, I'd say we'll get that booster this year, and then sometime in 2022 we'll be getting variant boosters as well. Travel safety is another thing I get asked on a lot. Basically, I'll tell you, well, local is just as risky as everywhere else, and maybe even worse. Airplanes have good air exchange, so if you and they have mask requirements, and so I actually don't think airplane travel is that risky. It's actually the most dangerous thing is your trip to the airport, the jet bridge, and what you do when you're traveling, not the airplane actually. So basically, get vaccinated, wear a good mask, and then be careful about the other stuff. I don't think it's the plane trip that's the problem. Um, and I've stepped up to a little better mask. So when I'm in an environment, I'm a little more worried. I actually like the KN95s they sell because they're adjustable. They fit really well. I think they're more breathable than a cloth mask. So this is the one I'm using lately. Again, we get out and do stuff. We go to the winery band concerts. There's plenty of spacing here, so I do not wear a mask in this unless I'm going inside to the use the bathroom or something like that. I think this is a plenty safe environment. We did go to the Sheryl Crow concert where if everybody bunched up, and I have no idea what the vaccination rate was there, so I did wear my mask at the concert. Maybe after my booster, and it's been another week or so, maybe I'll feel more confident about a crowded concert. But any outdoor activity is good. So again, you can get out and do stuff and have fun still. Last thing, we'll talk about the employer requirement, vaccine or a regular test that came out from the Biden administration. My initial reaction to this was first, well, maybe this is a little too much. But as I've had time to think about it and study some other things, I think this is just where we need to go. I wish we didn't have to do it this way, but I don't see an alternative because so many governors aren't following along and cooperating. I think this is the only alternative left, unfortunately. Interesting history of the weekend. Someone tipped me into this letter from a physician, Henry Edmonston, asking for, basically arguing for the necessity of adopting legislative measures for cowpox vaccination to prevent smallpox. It's an interesting because he first starts out taking down this Mr. Thomas Brown, who's an anti-vaxxer of the age, basically going through his letter he'd written to an Earl point by point, even hits on the what because Thomas Brown makes the base rate fallacy that I talked about a few weeks ago. Interesting, he has his own term for them. He calls them anti-vaccinists as opposed to anti-vaxxers, but 200 years ago this was a problem. And the freedom argument came up again, and he talks about this guy, quoting, "England is a free country, and the freedom which every freeborn Englishman chiefly values is the freedom of doing what is foolish and wrong and going to the devil his own way." So this whole freedom argument, which I don't get either, well, that's been around for a couple hundred years now. So that's basically why, because of this attitude, that's why he's arguing we have to do legislative sort of heavy-handed measures. And then, interestingly enough, he goes on to quote comparative mortality rates, noting that, for example, in Bavaria, where they had these requirements to get vaccinated, to go to school, or even get married. And some of you who are older than 65 may remember the time when you had to get a syphilis test to get married. So this isn't a new concept, actually. But only 5 people in Bavaria died in the course of 11 years, whereas in Edinburgh, where they've been doing this stuff, they had 1,300 people die just in the last year. And using mortality, because like I've said in the past, mortality, dead, not dead, is the ultimate quality measure. And so, what are those numbers? Well, surprisingly, U.S. we're a lot like the British. Unfortunately, we did pass them in mortality actually, because the British are doing a better job of getting everyone vaccinated than us, and so we've actually done worse than the United Kingdom. Well, not as bad as Brazil. If we'd have done as bad as Brazil, we'd have another almost 300,000 dead Americans. But if we'd done as well as Germany, we'd have 300,000 less. If we've done well Norway and Japan, we'd have 600,000 less. And again, arguing for Lincoln Lancaster County's approach, our mortality rates on the level of Israel actually, because we've been able to put in our own measures and we've been able to follow the public health evidence. Omaha hasn't done quite as good because our public health department's been overruled by the state of Nebraska and can't put in these measures, but some of their schools have, for example. And I would compare us to the rest of the state, but our governor is still hiding all the data, so we can't. So I'll just use Iowa as the comparison case. So Iowa's done just as bad as the rest of the United States, but if we had done as bad as Iowa in Lincoln, we'd have 367 more dead of our fellow citizens. I think it's been worth it. And you know what? Our economy's done fine. We've had kids in school. We haven't had to close down a single classroom. Our economy's doing great. We're under 2% employment, and we're still able to go out and have fun. So I think we have the right approach. I wish the rest of the state was allowed to follow ours. And why do we need vaccine requirements? Well, United States, UK, and Israel, we started at the top. We're not in the top anymore. Most of the developed world has passed us. And most of the developed world has vaccine requirements, actually. And so countries like, Ireland, Chile, China, Denmark, Uruguay, Singapore, Spain, Qatar, Portugal, United Arab Emirates, all far ahead of us in vaccination rates. Even Japan just passed us, and Japan had an excruciatingly slow start, but even Japan's better than the United States now. So we're going to have to do something. So I guess I am kind of going along with the Biden thing that if we can't do it through the states, our employers may be our best route. And my organization, we've already done that ourselves. We did it a few weeks ago. So everybody in my office is vaccinated. And we've been doing this for decades. Our school immunization requirements, so we've had these in place for decades. That's why we do not have outbreaks anymore and have to do quarantines for things like polio and diphtheria and measles, like used to be done. And everybody's forgotten that because most of the people who are alive in those days aren't around anymore. So we've forgotten history, and so we need to get back and learn what we've forgotten, unfortunately. So hopefully this is helpful to you. Again, this is what I do for a living, so you can verify that I am who I am. But of course, disclaimer, these are my opinions, not necessarily those of my organization I work with. If you go to healthylincoln.org, you can look at the past videos. Thanks.